No, it's already there. You just tap it.
Good evening, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to today's live panel discussion on bridging knowledge gaps, addressing educators' challenges in insulin administration training, organized by Voice of Healthcare and supported by CRIAMED. We are thrilled to have such an esteemed panel of experts with us today as we dive into one of the most critical aspects of diabetes management, effective insulin education. As many of you know, insulin therapy plays a pivotal role in managing diabetes, but ensuring that patients are properly educated on its correct administration is a challenge that persists in healthcare system globally, and India is no exception. Poor insulin administration can significantly affect treatment outcomes and patient quality of life, making the role of educators in this process crucial. Today, we will explore the challenges educators face, the innovative solution being implemented, and how collaboration among healthcare professionals can create a more informed and confident patient community. Let me introduce our distinguished panelist, Dr. Manoj Chawla, a renowned consultant in diabetology at Hinduja Hospital, Mumbai, who brings a wealth of experience in managing and educating patients on diabetes and insulin therapy. Welcome to our show, sir.
Thank you. Thanks for having me here, Simran.
Thank you so much. Dr. Pulrenu Chauhan, consultant endocrinologist at PD Hinduja Hospital, Mumbai, who has been at the forefront of endocrinology and brings valuable insight into the clinical side of insulin therapy. Welcome to our show, ma'am.
Thank you for having me. Thank you.
Thank you so much, ma'am. Ms. Marilyn Olivera, Director of Clinical Education and Operation at JV EdTech Medovation and Director at VanaRaksha Foundation, Mumbai, whose expertise in clinical education and operation has helped transform diabetes education through innovative approaches and digital platform. Welcome to our show, ma'am.
Thank you. Thank you so much.
Thank you so much. Dr. Rashi Agrawal, consultant endocrinologist at Kokilaben Hospital, Navi, Mumbai, who specializes in endocrinology and has dedicated her career to improving patient outcomes through personalized diabetes care and education. Welcome to our show, ma'am.
Thank you. Thank you for having me for this wonderful discussion.
Thank you so much, ma'am. Throughout today's discussion, we'll address the hurdles in educating patients about insulin administration, explore new technologies and strategies for better engagement, and look into the critical role empathy plays in overcoming psychological barriers. We look forward to hearing our panelists' insights and experiences and how we can bridge the knowledge gap in insulin administration, education, and improve the lives of millions living with diabetes. Now, without any further delay, let's get started. I would like to ask my first question to Dr. Manoj. So, understanding the current landscape, what do you believe are the most critical gaps in current insulin administration education, and how do these impact the patient care in India?
So, Simran, let me first say a big hello to everyone who's joined in and congratulate VOH for taking up this topic. I'm sure all my co panelists will agree that being in the field of trying to help people with diabetes, one of the largest and disappointing problems that we all come across is the fact that our patients, of course, there continues to be a huge myth around insulin therapy. There are large number of patient and physician based barriers in insulin treatment itself tends to be delayed for far longer than what it should be used or advocated or what any of us believe. Having said that, a larger problem continues to be those who are advised insulin therapy, the lack of education around the right injection technique, the means of rotation of injection sites, the fact that today insulin injection technique has evolved to the use of extremely fine syringes and needles which are almost painless, the fact that we shouldn't be reusing these syringes or needles, there continues to be a huge gap in terms of the education offered to patients. Now, we've always believed that it comes up that as one of the barriers for insulin treatment itself is the time constraint that our physicians would have in their busy practices across India. The numbers that all of us see is much different than what our counterparts in the West would see. The ability to give kind of time to an individual patient. So on an average, we would be giving 10 to 15 minutes to a patient, which will also be a luxury at times. So today, diabetes has evolved to being a more holistic approach, and that's where the need for the teamwork, of which the diabetes educators form an extremely crucial role. Right from the initial conversation about insulin therapy to the right means of administration, the right injection technique, the rotation of sites, and the avoidance of reuse of syringes and needles needs to be spoken about to the patient at the time that insulin therapy is initiated. It's extremely painful for us to come across a patient who has been put on insulin therapy and has been taking that for years and comes and tells us that he or she has been taking it at just one site, which could even be a wrong site, which is not advocated, but taking at the same site for years together without rotating it, landing up with all the problems of lipohypertrophy and so on, which is lumps which are created if you keep injecting at the same place. This has huge implications. It has implications towards poor control. One would keep scratching their minds and wondering why somebody is not responding to insulin therapy, just going on increasing the dosage of insulin. Well, it doesn't help. Unless your technique is right and you're following those simple norms, you're very often wasting the entire aspect of insulinization and the therapy and the titration. So extremely important that this has to start right from the beginning when insulin is spoken to or spoken about to the patient or their caregiver support or family or other members. And also, this is something that needs to be repeated on a regular basis. You're mute, Simran.
I'm really sorry for that. But thank you so much, Dr. Manoj. You touched upon very important topics of why this administration and the education is required, so that this proper education plays such an important role to the patient and to the families as well.
So,
So
sorry, I didn't complete. I was talking about being painful when patients come back having taking injections and not taking it properly. That's worrisome. And then they say that nobody ever told us the right way to take that. I think initiatives like today are meant towards changing that awareness and the trend, which is disappointing.
Thank you so much for mentioning that, sir. Moving on to my next question to Ms. Olivera. Ma'am, with your extensive experience in clinical education, how would you assess the role of structured training in improving this patient outcomes, particularly in insulin management?
Thank you, Simran. Thank you for this question. First and foremost, the esteemed panel over here, Dr. Manoj has already set the stage that education is very important, especially with regards to diabetes care. And we've also seen that there is a shift that like earlier, it was only the patient would go to a clinic and meet the doctor, and the doctor would explain, would counsel, would do everything. But then gradually we've realized that there is role for education. And so now we see that the scenario is changing. It's no more, it's not only the doctor's clinic, but along with the doctor's clinic, there's also a diabetic educator who meets the patient. And when he or she meets the patient, that time they also assess the need. What exactly is the level of understanding and how much can the patient understand, and then based on that, an education program is given. This implementation has found to be many researches abroad as well as the same thing when it was done in India. Also, it's seen that it is found to be more effective in self-management of insulin. So that's the reason this is a model which is adopted by most corporate institutes these days of having an educator on board. Now, what is the role of this educator? Especially because of more contact with the patient, there is enhanced accuracy of the dosage that is being mentioned, and it also boosts the patient's confidence because that educator is like a guide, a help. So, along with the doctor has said something, but along with the doctor, she's also reiterating the same facts and also being very empathetic and listening, assuring them about support. So whatever little doubts patient encounters can be ironed out in this kind of a session. So it boosts his confidence and helps in preventing complications. As Dr. Rightly said, that the patient has been taking insulin, yes, but he's been taking insulin at the same site. So when that happens, it leads to a complication called as lipohypertrophy. So which necessitates that increased doses of insulin be given. So all these problems, complications can be avoided. Sometimes even it also, these structured programs also touch upon not only insulin management, but also different topics such as diet, exercise, foot care. So all of these are taken care. So patient is looked after in a holistic manner. Next is it also encourages patient that it gives him the confidence that yes, he or she can handle it. And it's not that living with diabetes is not, it can be made more enjoyable. And there is a partner to share your concerns. So that way it enhances and it also improves. Like whenever you're coming for a follow-up with your doctor, the educator is also there who is also taking a follow-up of how have you been and how things doing with you. So it's like a friend and a guide along with this. So then that is a role of education, I can say, is non-negotiable in today's world. Thank you.
Thank you so much, Ms. Marilyn, for answering that question. Moving on to my next question, Dr. Rashi. Ma'am, there is this cultural and regional barrier in our country, given the diversity in India. How can educators overcome this cultural language and literacy barrier when teaching insulin administration, especially in rural areas or underprivileged areas of our country?
Thank you, Simran, for that question. I think before I answer that, I would first assert with what Dr. Manoj has said that starting any insulin or initiating insulin is a very difficult job for any practicing physician, diabetologist, or an endocrinologist. And the resistance is kind of equal, I would say, if not more, but if it is equal across settings, whether it is rural or urban, and the myths surrounding that are also equal. So we definitely need more and more efforts, and that too, we have to simplify things. Basically, I as an endocrinologist, I believe that the more we simplify it for the people, the better it is accepted. And the role of an educator is undeniable in that case. And a few of the things that I can think of actually are like using visual aids, like any other medium of instruction in these areas. Visual aids like charts or videos in the vernacular languages. Also, we have to incorporate people from the local area. Basically, somebody who's well versed with, who's bilingually well versed, the ones who understand the medical terminology as well as understand the local language. They need to be incorporated in the education setting. So it really means that we are taking diabetes education to the grassroots level, which is actually the dream for every practicing physician or an endocrinologist who want to, manage diabetes. Because it is, unfortunately, India is the diabetic capital of the world, and we have the maximum number of diabetes patients. And it is not only in the urban areas; the proportion is almost equal, or sometimes even more in the rural settings. So one of that is definitely some of these means are there. Plus, we have to use simpler languages. Of course, we can give analogies like how you, as sir has mentioned about insulin administration techniques. Also, insulin storage is a one big concern. There is a lot of notion around storing insulin. So there have been times when patients have been denied insulin because they did not have any mechanisms to refrigerate it. But now we know that one, there are indigenous methods to keep the insulin vial in a cool place, and second, some of the insulins actually do well even on the room temperature, provided they are not exposed to sunlight, direct sunlight. So those kind of education and those kind of myths need to be broken time to time. And explaining, we can give simple analogies of how we store food. Same kind of analogies can be given for insulin storage as well to the local public. And obviously there are ways of dramatization, like role plays or things like that, can also help in making them understand the value of insulin techniques. Also, one more thing that can be used is like after learning, it's like a feedback teaching. So once we've taught something, we can ask the people to actually emulate what we have taught and tell us how would they administer in a mock setting. So that will kind of help us understand how well our education is really percolated. So these are some few points which I think may help breaking the cultural barriers.
You said it right, ma'am, and these are very important so that
I'll
the
just
correct
I'll call
education
you.
can reach out to the masses.
Apollo.
Uh, Moving on to my next question to Dr. Pulrenu. Ma'am, simplifying the complex concept. So, insulin administration involves various complexities such as dose adjustments and device selection. So, how can educators simplify these concepts for patients who are new to insulin therapy?
So, a very good question. I think as basic health givers, whether it's the doctors, the nurse educators, the dietitian, and all that, all of us should understand that taking insulin is not going to be a very easy task. If I have to prick myself 2 or 3 times in a day to check the blood sugars and then take insulin, it's going to be very, very difficult. And to do it day in and day out. So, first and foremost, as we go across to the patient and the family, we must realize that there are many, many people who are influencing our patients. Then there is media, then there is newspapers, then there's lots of information given right or wrong, which the patient is going through, discussing outside, and then coming to us. The first response is that I don't want to do it, give me something else. So, having said that, I can only say that empathy, sensitivity, and being very, very clear in our instructions is very important. Also, another thing that I've noticed that automatically, whoever may be the patient, whether type 1, type 2, young, old, we start speaking in a language that they don't understand. We must speak in a language that they know, they understand, and very, very simple terms. They've come very often. We see that many patients read about it in the social media. They come with lots of information and all that, and misinformation. Clarity is required. There are many people, as I said, who are giving wrong information. So we need to simplify everything, as has been discussed earlier. We have to teach them or tell them why they need to take insulin. Most of them like to hear that abhi thoda time lena hai, fir band kar denge. So if the situation is such, then we must explain that it's very, very important why you need to control your blood sugars, why the medicines are not working, and why we need to take insulin. As somebody has already said, make it simple, make it correct, and be very firm. So, when we are talking to our patients, there's so much of bargaining going on. कि ये भी कर लो, वो भी कर लो, अभी मैं बाहर गाँव जाती हूँ, 2 दिन नहीं लेती हूँ, अभी स्कूल की एग्जाम है. So I think all of us should be firm and clear in what they understand, and keep reiterating this fact that no, this will not do. The other thing is that simplify, as all the speakers have said, simplify. Tell them what is insulin, how it works, in the language that they understand. Nowadays, glucometers and other tools are available, which makes monitoring the blood sugar very, very easy and maybe a little cheaper too. And it's available all the time. So the method in which we are monitoring should also be made to understand. So often we tell our patients that to validate your meter, check the blood sugar at the same time as you're doing a blood test. So the learned technicians who come home or where we go to, they put a drop of blood from the vein, the venous sample, onto the glucometer. So these things we know. We know that gives wrong readings. We need to educate. In our practice, first thing is the diabetes nurse educators, very, very important. So after we speak to the patient, the relatives, etc., then she takes over. And these simple things are absolutely simplified. Also, giving too much of education to the patient and overloading their brains or with too much information, itself is detrimental in their practice. We monitor the blood sugars, we give them some kind of a formula. The formula is individualized, it doesn't work in the same way in each and every patient. Of course, we need to talk to them about food, about exercise, the manner in which it influences the blood sugar control, and give a little leeway in terms of what they can do on weekends. Suppose they are young children, sports day, walking, and how it all influences. Again, there's not a single formula, which you can say इतना हुआ तो many people say that हमको एक range दे दो, इतना है तो इतना करेंगे, इतना है तो these ranges don't really work. As I said, everything has to be individualized. If we see the records that the patients have kept, we generally have an idea how a patient is going to behave. What is the weight of the patient? Is he going to exercise? Will he be able to change the doses? Is he going to listen to you about food and carb counting and all that? So once we get an idea, we can simplify the entire thing and explain. Here again, the nurse educator has to be in sync with your ideas. I say something, she says something, then the dietitian says something, that won't do. So as we all agreed that we should have one second, I'm sorry. We should have some kind of a group within our own clinic or in a hospital and work together in the same way so that the minds of these patients doesn't get confused. Also, as I said, that keep it as simple as possible and give a leeway as to how much dose you should be able to increase and how much you should be able to decrease. So these are actually very, very simple methods. Keep on repeating it. Here, the diabetic nurse educator is very important. So the patient keeps in touch with the nurse educator or with us or our juniors. And initially, lots of correction is required. Once they get a hang of how to adjust the doses, it becomes very, very easy.
You pointed out very crucial points, ma'am. We need to keep it very simple as it is very new to the patient about the insulin intake, the diabetes, the changes in their lifestyle which needs to be done, and all the other modifications. Like you mentioned, if every day you have to prick yourself 2-3 times just to check your blood sugar and then insert that insulin, it is very difficult. For doctors or for the medical people who are into this medical industry, it's easier to understand, but just a person who's going through that, it becomes very difficult because they do not know the complexities, they do not know if something goes wrong what will happen to them. So I think all those things are very difficult to make them understand and to do this on regular basis. So starting with that hand holding so that they get a hang of it, and then simplifying all those things to them is a little steps how we can introduce all such things into their life. So I think you pointed out very important points, ma'am. Thank you for that. Moving on to my next question to Miss Marilyn. Ma'am, what role do visual aids, mobile apps, and digital platform play in making insulin administration training more accessible and easier to understand for patients? And how have you seen these tools used effectively?
Very important, and thank you for the question, Simran. These days, actually, what happens is you'll see that visual aids, as the esteemed panelists have already mentioned, that use of these roles, it's like it's in addition to what everyone is saying, because there is a lot of fear, there is a lot of information, but sometimes there is lack of authentic information. So these visual aids actually help to see. It's like a visual sensitizer which is actually helping the patient to understand better that what I'm doing is right, and it's a reinforcement of information which is taking place. Now these also help patient to make it help the education to to make it more engaging and also appealing. So earlier we used to have a lot of visual aids like flip charts, and charts. But now it's slowly turning its round, and now we have more of those digital gadgets which are there. So these actually help, and they help in simplifying the task. Whatever complex information is there, they help in actually a very simple thing, like it's time to check your sugar. So then even those small reminders that these digital apps help. So it's like now a person can say that I forgot. Technology is there to assist you with those reminders. So these apps play those role of being like that buddy who will remind you, who will nudge you when you tend to forget about your insulin dose. So it won't let you forget. Plus, it is making something task simple, and also it is enhancing your patient engagement. Like you given some information, some interactive games where it's like you interact, you tell what you are doing, and then they also mention that okay, what is the next thing in store for you. So that way it helps. Also, it offers a lot of support, so that now the patient somewhere feels that he's not alone. There is someone along, and whatever doubts, queries are there, the app is also, there are more FAQs which are mentioned. So those frequently asked questions sometimes are there, so you can scroll through them. So that also helps in supporting the patient with authentic information. So in addition to what the doctor is saying, what the educator is saying, these visual aids are also reiterating the same fact. So when a person is trying to just find out many people saying the same fact, okay, then this is authentic. So that's how the patient's mind also, it gets registered, and it is, these things help patient to comply better with his insulin management. And nowadays the role of videos is very much seen. So like these videos actually, uh, no one is going for fancy videos, but the educators and the entire team is designing their own videos. So it's really very nice to see your own nurse demonstrating and showing them that yes, this is the way, this is how you rotate the site. One aspect is insulin administration, but along with insulin administration, even there is an opportunity where about diet, rotation of sites, foot care, all of these, some smaller videos are prepared, and they act as ready reckoners for the patient. So thus simplifying the entire process of diabetic management. And it's not only patient, it is patient centric and patient paced. So these help for better management. Thank you.
I think you pointed out right that nowadays so much of information and help is available online, whether it is through this videos or this applications. Companies are themselves making what is the right way to do it or not the right way, and then the manual which comes up with all those products helps a lot in identifying or educating people what is the right way to do it. So yes, right, you rightly pointed out. Moving on to my next question to Dr. Manoj. So, how do you educate patients? Like Dr. Ferdinand also mentioned this point about this factor of how much insulin needs to be intake based on the lifestyle, the diet or exercise. So, how do you educate patients on adjusting their insulin dose based on these factors? And are there any specific strategies you use to ensure an accurate understanding of dose adjustment to your patients?
So, Simran, a difficult question, and the right answer to that will take at least an hour and a half, the least. But I'm going by what Dr. Pulrenu said, that keep the instructions simple. So let me start off by saying that we heard a lot of conversation around means of reaching out better and making sure that the patients learn and adapt to this and adopt the right technique from the beginning. One of the um, things, one of the aspects that I think have seen probably succeeds is having the conversation with the patient about insulin and insulin injection actually much before he or she is going to need it. Now, clearly letting the individual with diabetes know right from the beginning, the first time that they see you, even if they don't need insulin, that there is a possibility of that being one of the treatment options, creates that mindset where we ask people to keep an open mind and not, have emotions like I will die but not take injections and so on, and stuff that we listen to. So we keep building on about the aspect of insulin. Second is the moment you mention injection, for many who have never seen it or aware, the perception or the thought of an injection is like any other injection that they would have taken from their family physician, be it a vaccine or a tetanus or any such shot. So when you talk about injection shot, the perception is that injection which somebody has to inject into me intramuscular. Not many would be aware that it's a simple injection which is subcutaneous, which is not painful, and it's easy to learn. There's nothing wrong you can do, and every individual with even limited background in education and social support can still learn and take this aspect. The other thing I think which succeeds very often is trying to see if the patient can take that first shot of injection in front of you. So that's an aspect. Then when you initiate injections, we've seen that practice over many a years, that if the patient buys it and comes, and if the timing is right, of course, not all injections can be taken at any time of the day, but if the timing is right and it works out, they take the first shot in front of you. It works the best in them overcoming that fear of the needle and that barrier of initiating insulin. Very often you may prescribe, then they have afterthought, somebody in the family will speak something against it, and it all goes into oblivion. Coming to your question, which was what? I answered the things around it. Which was your original question this time around?
Yeah, so it was, how do you educate patients on adjusting their insulin doses?
Adjusting the dosage, right. So,
Yeah.
well, fortunately, what's happened is with the evolution of insulins, you've had good, simple, once daily insulins which have come in very often now. We tend to initiate with these so-called basal insulins, which are very, very simple titration means. So you will teach the injection technique. You will talk about the dose. You may start off with a small dose, which may be just about 10 units per day, and give them simple targets. So with the use of monitoring, it could be the use of glucose meters today. It could be the use of CGM, that is continuous glucose monitoring, that many of our patients are adopting. You give them simple targets, look at one sugar, one timing, which may be fasting, and then you give them an algorithm with the values that if it goes above this, you add +2, it goes below, you do -2. And many studies and data has shown that when you teach it to the patients, there was a time where physicians felt it was not appropriate and the patient should send them the readings and they or their educators should guide amongst the +2, -2. Or another means is you teach the patient themselves. As I was saying, many studies have shown that there's been no difference. So if you teach your patient, they do it as well, and the outcome is going to be the same. So in today's times, where anyway the physician or the educator is burdened, you can have simple targets for the patient, give them the numbers, insist on regular monitoring, documentation of that monitoring, and change in dosage. So many of us use logbooks, or hospitals, OPDs, clinics will have logbooks where you ask patients. Of course, in today's times of connected care, you have digital apps. So the readings from the glucose meter can be directly transferred to the app on the phone and gets even connected to your hospital OPDs and clinics, where you can see the entire reading. You can encourage the patient to enter the dosage and what they have eaten. That also gets documented. So one is the simple algorithms to give them simple targets till they come to you. For, of course, those who require multiple injections, and these are mainly patients with type 1 diabetes or few with type 2 who go on to multiple injections, we do get into talking about carbohydrate counting. There are other aspects which I said probably out of the purview of today's conversation: insulin to carbohydrate ratio, insulin sensitivity factor, and so on. But we teach them means of checking their sugar, understanding the amount of carbohydrates that may be there on the plate in front of them, and then adjusting their insulin dose. Now, this aspect, of course, requires training, and we do take help of our educators and nutritionists, and it's an ongoing process. So I loved the communication. Again, I'm referring to it what Dr. Pulrenu says, that don't overburden the patient. Let's understand you're initiating insulin. Well, they're anyway, they feel a little burdened with that. So let's take it slowly, give them instructions, give them the technique, give them the rotation, tell them to avoid overuse and monitor. But too much of information is, of course, difficult for grasp. Sometimes educators and doctors also may be extremely enthusiastic and wanting to give that knowledge, but the grasp is going to be very, very poor. So you talk to that, but make sure that in the follow-up visits, you are again having a conversation. How much of what you said are they following? How much did they not understand? Was there the knowledge gap? And let's reiterate without being judgmental or without saying, oh, I told you last time, but you did not follow. Well, this is something that is going to take time, and keep doing it gradually and continuously.
I think that communication plays a very great part in terms of where you actually have to educate your patient and take that confidence in, if you do this way, this will happen, and things will be sorted, it will be easier, and all such things. So that education plays a very important role, and I think that education and communication builds that trust between the patient and the doctor, or let's say the educator, which is very important. And let's not make that as an obligation. You have to do it, and like you said, we cannot be judgmental. Oh, you didn't do that time as we told you. That tone of communication, that trust, plays a very important role in, where your patient obeys what the doctor have said. So moving on to my next question to Dr. Rashi. Dr. Rashi, when patients are choosing between different insulin delivery devices, that is syringes, pens, or pumps, what factors do you consider important, and how do you guide them in selecting the best option for their needs?
Yeah. Thank you for that question. So I think the crux of the discussion today is that we have to empower patients. Diabetes generally now everybody is moving towards patient-centric approach. Even in conditions like cancers, also there are options of chemotherapy available, and people are given the pros and cons. So the same thing applies even to a non-communicable disease like diabetes as well. It has to be a structurally the structure should be patient centric. Absolutely, the power lies in the hands of the patient, and our job is only to facilitate the usage of a certain device or anything of that sort, to make things easier and to improve their glycemic control basically. So having said that, there are mainly three insulin. So there are two types of devices that are in practice. One is to monitor the blood glucose levels, and second is to administer the insulin. And then there comes the third thing, which is the third generation pump, which has combination of both, which has a sensor as well as an administrative device. So that is the thing. So basically, when we talk about insulin administration, it is usually done in the form of pens, syringes, or pumps. So again, each has its own pros and cons. Obviously, one thing that has to be taken into account is patient's age, patient's lifestyle. If the patient is leading a very active lifestyle, patient is on the go all the time, it is not possible for the patient to have a syringe and a vial handy at all times. So they do prefer pens actually. So it becomes much simpler for them to take it in a discrete manner actually, and storage also becomes simpler. If the affordability is more and if the patient fits into that criteria, even insulin pumps is a very good idea for such patients who are always on the go and have a variable kind of lifestyle where they are going to have different kinds. There is no fixed meal timings, and the activity levels are going to vary. So even smart pumps like the third generation pumps and all, they can also help in titrating the doses for the patient. So that is an excellent situation. Second thing is about who is going to administer the insulin to the patient. So caregivers, if it is we are talking about children or elderly, both of them actually require support in terms of insulin administration. So the caregiver's level of understanding, level of comfort, level of education, all of that has to be taken into account before we prescribe one of these devices. So that is one of the things. Then coming to, I would say, what kind of hypoglycemia chances are there? Suppose a patient has a very fragile kind of a brittle diabetes where there are a lot of fluctuations of sugars. Basically, sometimes they have serious hypoglycemic episodes, and then sometimes they do have hyperglycemia episodes. So then again, pumps become beneficial in such patients because even microdosing is possible. There are alarms, inbuilt alarms in the pumps, which can actually cut off the insulin supply just as when the patient is approaching a hypoglycemic event, which is not possible with any other device. Having said that, the biggest detriment today to usage of pumps is one, their heavy cost, and second is the amount of training that is required. So if we are looking at something which is simplistic, that is for people who do not have the necessary resources either in the form of money or the willingness or education, then obviously syringes and pens are better. Again, pens are obviously more preferred among patients. I think as a rule, most patients would prefer pen over syringes, but then again the cost is a concern. So because pens are relatively more expensive than the syringe and vial kind of a thing. Having said that, even frequency of injections also makes a difference. So somebody, if they have to inject it only once at a night, suppose that only at night time basal insulin they are injecting, and that is when they are at home, then even using syringes is not a difficult task. However, if they have to inject multiple daily insulin injections, like pre-meals and a basal insulin, then sometimes patients do prefer pens actually. There are also now smart pens available which kind of give the feedback, which store the information about the units of insulin injected. They even indicate data, they alert in the hospitals, also healthcare facilities, about the amount of insulin being injected. So those are some smart pens which are available. So it is only getting better from here, but the center of all of this discussion remains the choice of the patient. Our job is only to facilitate this discussion and to make it an environment in such that patient has enough space to ask his or her queries, discuss his or her inhibitions, and we can only help them make the right choice. Yeah.
I think you mentioned very important points, Dr. Rashi, and I believe all these options nowadays we have is all because of the innovations which has happened. Earlier, I believe only syringes were the options, but now we have this pens, pumps, and like you mentioned, smart pens. So everything nowadays is possible because of the innovation that and the advancement that the medical industries have made. So and because of that, the patients have many other options based on the criteria they have to pick. So yes, thank you so much for answering that question. Moving on to my next question to Miss Marilyn. Marilyn, we know the importance of empathy in clinical education. So how can educator build the trust with patients to overcome the emotional and psychological barriers that hinder the insulin adherence? You're muted. Huh?
Yeah,
Yeah.
thank you so much for the question. Empathy actually is something which is a non-negotiable aspect of any. It's a soft skill which is required for every healthcare professional, whether it's a doctor, nurse, educator, or anyone. So, empathy, like to begin with, the first step would be understanding, listening actively. The very first contact that the educator and the patient has, it may be like first time patient landed up with some episode and of hypoglycemia and was rushed to the hospital. That's when he realized that he's having diabetes. So this entire episode itself is shocking for the patient and the family. So now, from this shocking situation, he has to come out somewhere and develop that trust. So when the educator makes frequent visits, tries to understand the patient and the family, their level of understanding or their lifestyle, non-judgmentally, like whatever patient they are saying, listens actively and tries to understand and offer solutions as per their lifestyle. That is when that first step of trust is established. Next is during each and every follow up, when the patient comes to visit the doctor, the constant meeting up and reviewing what has happened from the last visit till now. How have you been compliant with your therapy? Whether you've been taking your doses on time or managing what about your dietary restrictions? Have you been going for your walks, taking care of your foot? So all of this, when it's being done in a very friendly tone, so that also somewhere the patient eases out, and in a conversation he or she may just open up. When that person over there, again, as Dr. Rashi also mentioned, that there is nothing like a blame game or anything, but it's just very openly being open and just being actively listening, allowing the patient to ventilate his concerns, his challenges in day to day, eating those insulin uh, guidelines and following them, following the dietary restrictions, just with an open frame of mind, helps to build that trust. And not only that, but even suppose this time the HbA1c has come in a much better range. So celebrating those wins and acknowledging that, yes, you are the champion, you really done a great job. So that somewhere like celebrating as well as listening, these are the things that actually set the pace. Also, when you are saying that you are available for any concerns and you offer that, I'm just a call away, I'm just a message away, so that also helps in building that empathy that, okay, I'm not alone. What if something happens? What if my sugar goes low? Though you have empowered your patient enough by telling them that, yes, you can carry a medical, you can carry a small note with you can carry your set of medicines plus some sweet in case you are not feeling that great, inform your family about it. But still, after all this, if you just put one more note that, yes, in case of any difficulty in your day to day, just get back to me or drop in a message and I will get back to you. Even that sort of a contact that, yes, okay, if I have concerns, I have someone to talk to about it. So that also eases that patient and helps to build that empathetic relationship. And when that empathetic relationship is built, then management of insulin is no longer a challenge, but patient also starts opening up about his difficulties, what he or she faces. And the educator along with the entire team, when they show respect towards patients conditions at home, that all, it's like a recipe which goes like 1 and 2 and 3 together. It makes for an empathetic therapeutic relationship between between the team and the patient. You're on mute, Simran, you're on mute.
Yeah, I'm sorry for that. Thank you so much for highlighting those important aspects of that psychological needs, that needs and the barrier that the patient needs during this time. Moving on to my next segment, that is innovation and technology in training for leveraging digital tools. My question is to Dr. Pulrenu. Ma'am, with the rise of digital health tools, what are the latest technological innovations in patient education for insulin administration that have proven effective in improving patient compliance?
So I think this question is already answered extensively by the previous the panelists themselves. And again, we keep saying that look at the patient and look at the family, look at the age of the patient, see the type of diabetes. And we deal, when you talk about insulin, remember one thing that when we talk about a type 1 diabetic patient, it's insulin for life. So those are the patients who generally, as they are growing up, along with their families, are going to face maximum number of problems. Then we have the other set who are much older, who already have a lot of complications and comorbidities, and therein you introduce insulin either temporarily for a surgery or an infection, or they just require insulin for life because their beta cells fail to respond to tablets. So here, even though a lot has been said about innovative technologies and online sessions and newer things that are available, remember that insulin per se, whether given by a vial or a pen, or especially if it's lifelong, it's a very, very expensive thing for the family. So we at our clinic definitely look into the financial status, the family background, the how is the family going to help the child or the adult. Then is care required? Do they are they okay to take insulin on their own? Are their family members also taught to give insulin, or family is just two of them? Nowadays, a large number of children and grandchildren stay separately, and the elderly couple have to stay alone. So, are caregivers required to do all this? So, whether it is type 1, type 2, whether it is now or temporary, a lot of money and care is required. As all of them have said, that we try to make the patient so confident that he is able to manage. So this is okay for younger patients, patients who are learned, patients who have support. But for elder people, it's really not going to be very easy. They can't see, or they can't hear, or they have a neuropathy, they can't feel, and they are losing balance. So I think all of us take into consideration a lot of things which are co associated. Again, now I forgot the question that you asked.
It's
What
about
will,
the leveraging digital tools. With the rise of digital health tools, what are the latest technological innovation in patient education for insulin administration that have been proven effective in improving patient
so,
compliance?
see, all of us have seen that about maybe 2 to 3% of diabetic patients are learned, and they have some kind of factor which allows them to spend on the latest gadgets and information and all that. But about 90% of patients, even today, do not have access, or even if they have access, they can't afford it. Okay, so as Dr. Chawla has said, that we start with the simplest tool, and obviously a pen is much better than a vial and a syringe. It's user friendly. The needle is very fine, and it's all available as U100 IUs, which is a concentrated form of insulin through the pen. And somehow, when we use the pen device, people don't get so scared as against a syringe, where you see the syringe, and as children also, we've taken vaccines. You see the syringe, and we get scared. So, as far as possible, we encourage the family to buy pens, use that device, not smart pens, of course. Maybe at another level, you can use those. And we we insist that at any cost, spend some money, keep aside some money to use a glucometer. Many people can't afford the CGM and can't afford it regularly. So, two things which they have to have is insulin through a pen device, which is adequately explained to the patient and the relative. We insist that one relative should know how to use the pen, how to sanitize the pen or not sanitize it too vigorously, and how to keep it aside with various climatic changes. We also insist that a glucometer is a must. Fortunately, they are not so expensive. The strips are going to get cheaper and cheaper. So these are two simple things that we advocate. Of course, that 5 to 10% of patients insist that they want the latest and they can afford it. Then, as has been discussed, that a lot of technology and devices are introduced to these patients as well. Thank you.
Thank you, ma'am, for answering my question. Moving on to my next question to Dr. Chawla. So, from a clinical standpoint, how do you monitor patient adherence to insulin administration over time? And are there any specific feedback mechanism you have implemented to ensure your patient stays on track?
So I think it's about the ongoing conversation. So among the better tools, so to say, is right from the beginning your conversation with the patient, making sure that you've simplified the process, given the right instruction, as we said throughout the program, about the right technique, avoiding reuse and so on. But more importantly, during the follow-up visits, again having the conversation if they were finding it difficult. Was there a reason that they were missing any of the injections? How are they handling it? We very often come across the fact if somebody is on multiple daily injections, even though patients may accept when we tell them for practical reasons they may be missing certain doses, especially afternoon doses. Or they may have issues if they have traveled, they did not take, or there are certain misconceptions about how to travel with insulin syringes and vials and pen devices, how to store it, and so on. So, to ensure adherence to any kind of therapy, what's important is your clear instructions. And because there are a lot of instructions around the treatment area and monitoring, having that conversation again about how are they managing, are they missing out, what can they do now? If they missed out a particular injection, can they take it a few hours later? Some injections are okay to be taken which are not in related to time of the food. Some have to be taken specifically in relation to time of the food. So again, this conversation, as I mentioned earlier today, a lot of digital tools allow individuals to pen down or note down digitally their injections, the dosage that they are taking, and the food. Also, one of the simpler means to understand If the patient is being clear and honest with you, is asking, having a conversation that if they are using a cartridge or a vial, how many days is it lasting? Now, you as a doctor would know when you prescribed a dose that how many days a particular thing should last. So you have that
Yeah.
conversation, and sometimes you will realize that, well, this should have gotten over in 12 days, 13 days, and patient is saying that once a month somebody is buying them or they are buying it. Something is going amiss somewhere. So it's again having that conversation, as I said earlier, not in a judgmental way, but with an attitude to figure out if there is a genuine problem or a lapse in understanding, and then try to help them with better understanding and solutions which are easy to adapt and adopt.
Thank you, Dr. Manoj, for answering my question. And like you emphasized again on the crucial part about the communication. And I think that needs to be the same from start to end. And there should be this regular follow-ups and regular checkups, which keeps your patient on track, so that the doctor and the patient both are aware the status of the patient and whether it's improving or it is getting worse or any of those things. So the actual steps can be taken immediately as soon as possible. Moving on to my last question for the segment to Dr. Rashi. Dr. Rashi, as an expert in the field, what steps can be taken to ensure that diabetes education, particularly around insulin administration, becomes more integrated and sustainable part of healthcare delivery across the country? You're on mute.
Yeah, thanks, Imran. Yeah, I think that is the idea. So I think 15 years from, if we rewind 15 years, endocrinology or for that matter even diabetology was very very naive, and it was diabetes was treated like any other illness. The importance of communication was not very well understood. It was more related to advent of new medications and somewhere around diet and exercise. Even that was not very very clear. It was like मीठा मत खाओ sugar control हो जाएगा, दवाई खाओ sugar control. That is all about diabetes, and that's all doctors used to also talk about. But we know that it has to be a team approach, and this team approach, as we were talking about in the initial part of this discussion, that it is not going to be only restricted to, see, diabetes is omnipresent. It is there everywhere across all sections of society, across communities. No community is spared from this disease. It's not selective at all, so even the measures have to be like that. So incorporating it, and what is omnipresent in India is our primary healthcare. We are also known for our primary healthcare, the kind of systems that we have inbuilt in our place in terms of PHCs and community health centers. So incorporating diabetes education as part of those. So previously these PHCs and CHCs were known to combat diseases like malnutrition, administer tuberculosis drugs, administer vaccinations. But now incorporating non-communicable diseases as part of their programs and giving it that much of importance is the need of the hour. And I think partnering with our country has the benefit of its population. Our population is also our power, and there are many organizations, one of yours also being part of it, who are talking about these things basically. So we have to partner with the right people in the right places basically. We have to take help from NGOs, from businesses who are willing to commit to diabetes care, who understand the value of diabetes care, and basically disseminate the information and educating. Basically, one more very interesting aspect is for bigger places actually accrediting hospitals, that they should have an inbuilt facility of diabetes education. They should have a dedicated diabetic educator nurse, should be a part of the accreditation processes, so that will kind of ensure universal care. So like it should be part of the standards, like how we have a necessary facility. If we have to set up an ICU, we need this many oxygen beds, we need this kind of support. Same thing actually applies for, even though it might look trivial, but it is actually having, and it is going to improve the quality of the patient care in the hospitals as well. And then obviously use of technology. So there are n number of apps that are being built in and around diabetes. There are n number of things to both monitor as well as to administer the treatment. So those have to be more and more accessible. So the thing is that nowadays irrespective of financial status, everybody is carrying a smartphone. I think that has become a basic necessity along with roti kapda and makan as a mobile phone. So same thing. So I think we should be utilizing that as a resource, and there is so much possible. Like we have so many digital apps for maintaining documents and things like that. Same in the same manner, we can have digital apps which can help have basically guidance as to managing their diabetes on their own, because at the end of the day, no amount of doctors, nurses, or the education staff can make the patients independent as long as they know how they can manage it on their own. So I think that all needs to be done. Yeah.
You rightly pointed out, Dr. Rashi, it's not just the doctor's efforts, it's the collective efforts, and how together, like the hospital, doctors, educators, the organizations who are the device organizations or organizations who are spreading this awareness onto this, or any of it together, we have to do this, and it's an integrated effort to spread this awareness, to lead this initiative, and uh, the technology is playing a very important part in this. And thank you. I would like to close this session by thanking all the doctors, panelists present here for coming to this panel, taking out time out of their busy schedule and being the voice for spreading awareness on diabetes and how important it is to administer, educate on the insulin. So thank you so much. And now, at the end, I would like to say that we are very thankful to Kriya Technologies for supporting this very important discussion. Is one of the only two manufacturers of insulin pen needles in India and are making great strides in improving the challenges faced in the delivery in our country. So we would like to thank Kriya also for this, and thanks a lot to all the doctors for sharing their insights and expertise with us, because your experience, your insights matters a lot to educate our public. Thank you so much.
Thank you.
Thank you.
I would like to thank Voice
So
of
that,
Healthcare
thank you.
in a special manner because for providing us a platform where a lot of gap, a lot of knowledge overload is there. So trying to bridge the gap. So thank you so much.
Thank you so much. Thank you.
Yeah,
Thank you,
bye.
ma'am.
Thank you. Thank you.
Thank you so much.